Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about Ozempic, Wegovy, semaglutide, Mounjaro, tirzepatide, GLP-1 medications that are used for diabetes and for weight loss. I see a lot of patients coming in on these, and there are a lot of questions around whether or not these medications also have some mood effects. So I'll tell you what I've been seeing. So a lot of patients are started on these medications for either better blood sugar control or for weight loss. And for those indications, they are miraculous medications. So they slow down gastric emptying, which slows the rise of blood sugar in the bloodstream. And because of this, they make it a lot harder for patients to want to eat more food. They naturally decrease the amount of food that patients are eating because they're slowing gastric emptying. Sometimes patients will feel ill if they eat too much food, or they'll have some vomiting if they eat too much food. So patients very quickly adjust to much smaller meals. They can also cause some food aversions, which is where patients are avoiding specific food groups that make them feel ill because they already slow gastric emptying. So proteins and fats slow gastric emptying on their own. And so add that to the GLP-1s and you have very delayed gastric emptying. So a lot of patients will develop food aversions to high protein or high fat foods, which can also cause significant weight loss and improve blood sugar control. When patients lose a significant amount of weight, they also get better blood sugar control. So for a lot of people, these are just miracle drugs, akin to having massive stomach surgeries like gastric bypass, Roux-en-Y, duodenal switch, gastric sleeve, which are big, invasive, not reversible easily procedures. And so these medications can be really dramatic, miraculous medications. I am seeing a lot of patients who were having difficulty with alcohol find that they no longer even think about having a drink on these medications. So that's one really positive mood effect that I'm seeing, because without the alcohol, patients are feeling so much better. They're sleeping so much better. They're having less anxiety. And a lot of patients who have self-medication with alcohol or who have some drinking behaviors that may not be healthy, they're finding it very easy to forget they ever used alcohol and stop using alcohol on these medications, whereas before it was very difficult to give up alcoholic beverages. So I'm loving those medications for that because I'm constantly trying to get people to give up alcoholic beverages. And a lot of patients who really struggled with weight loss or who struggled with really difficult eating behaviors, binging, purging, obsessive calorie counting, cyclical dieting, are finding that they just have a lot less mind chatter around these things when they're using these medications. So that's been really helpful for mental health. When you lose 100 pounds, for a lot of people, that makes them feel more energetic. They're more able to exercise. They're more able to get out and socialize. They're much more comfortable in their bodies. And for better or worse, they have a lot less social anxiety and mind chatter around their appearance and the way they look. And so they're finding that that's causing some mood benefits. Now, there is no data in any of the trials to suggest increased suicidal ideation, increased depression, increased anxiety with any of these medications. So we really don't have data in clinical trials on that. Now, there has been some chatter in a post trial large population study that they are seeing some slightly higher rates of anhedonia, of decreased pleasure in doing things, which, food gives us pleasure. Food is a huge source of dopamine. A lot of people talk about eating their feelings. And when you aren't able to do that, food as a coping strategy is taken away, and you have to find other coping strategies. So there is a little bit of, decreased pleasure in life when you don't have food as a pleasure, and decreased ability to use food as a coping strategy, which can be sort of unsettling. And one of the things that I see is sometimes as patients increase the dose, higher and higher doses give you better and better weight loss. As people get to higher and higher doses, I do see somewhat of a flattening effect where things that used to be very pleasurable, whether it's alcohol, whether it's video games, whether it's gambling, whether it's other things that have that dopamine kind of flavor in there, just really aren't as pleasurable. And we know that dopamine can factor into depression. There are a lot of medications that actively work on dopamine. So we know that some of the GLP-1s have this kind of theoretical effect on dopamine. Now, all the GLP-1s work really well with SSRIs, other antidepressant medications. We don't see any problems with medication interaction. Although as patients can lose 100 pounds or more, sometimes the dosages need to be adjusted carefully around those medications and other typical medications that patients are taking. So just some things about the GLP-1s. One thing to know about them is GLP-1s right now, the most popular ones are semaglutide, which is also known as Ozempic and Wegovy, and tirzepatide, which is also known as Zepbound and Mounjaro. Those are the typical insurance names. There are lots of places you can go to get these compounded, and they're coming out with new oral medications like Rybelsus. So expect to see that coming around any day. The two, semaglutide and tirzepatide right now, are weekly injections underneath the skin, very painless injections, but a lot of people won't use them because they are injectables. They have to be stored in the refrigerator. They're very expensive right now unless you buy the compounded medications, which the FDA is really cracking down on compounded medications right now. So those are just some things to kind of be aware of. But the too long didn't read summary is that right now we're seeing a lot of benefits with tirzepatide and semaglutide, and not many downsides for the patients who need them for blood sugar and for weight loss. Not many downsides on their mood effects. So just something to look out for, and I hope this answers some of your questions.